Today we will discuss about hysterosalpingogram or HSG test. So this is a test which is done to check the patency of the fallopian tube in cases of infertility patients. So HSG is a procedure where an X-ray will be taken to check whether the fallopian tubes are open or blocked. So there are two fallopian tubes, one on the right side and one on the left side. And when we do this test, we ideally are checking whether the tube is open or blocked, but we don't know whether the tube function, that is whether the functionality of the tube is good or not. We will not be able to check it in the HSG. We are only checking whether the tube is open or whether it is blocked at any point. So this test is done within 10th day of the period, ideally. And the reason is because we don't want the patient to be exposed to an X-ray when the follicle is developing, which usually happens after day 10. The second thing is, this is a very simple outpatient procedure. This can be done either with anesthesia or without anesthesia. If the patient is very sensitive, then we do it with anesthesia. Otherwise, we just do it as an OPD procedure. The procedure time taken is about 5 to 10 minutes, but the preparation will take a few minutes more. So in this HSG test, the patient has to come prepared, and the preparation needs to be as follows. One, the patient, if it is not under anesthesia, she can have light meal and come. She has to wear dark colored clothes so that if it is stained or anything, then there will be no discomfort to her. Third thing, she has to carry a pad in case if there is any spotting, bleeding. Also, she needs to come with an attender. Ideally, it need not be only her husband. It can be either her mother or any relative, any adult who is responsible can come along with her. And the procedure is done in an X-ray room, and it will be either done by the infertility specialist, that is the gynecologist, or it can be done by a technician. So here we put an instrument called a speculum in the vagina, and we will insert a cannula which will fit into the cervix, and then we push a liquid dye which is called urographin, and this dye, when it enters the fallopian tube on both the sides, then we will take the X-ray. So this one X-ray sometimes may not be able to give us the full information, so we may have to take 2 or 3 X-rays, and once the X-rays are taken, we will evaluate whether the dye has entered the fallopian tube or not, and whether it has spilled through the fallopian tube into the abdominal cavity. So this is actually the reporting is done by the radiologist, and the patient will get the report the same day. So once this test is done, we ideally prescribe the patient to take antibiotics for 5 days and also a mild painkillers. The patient will experience slight discomfort when we are pushing the dye inside during the procedure. She may feel sudden catch, and the more she is relaxed while doing the procedure, the better it is, because sometimes the cornual block, that is the fallopian tube block, can come just because she is so stressed and the muscle will go into spasm. Also, we give her pre-medications called atropine and also an antispasmodic to relax the muscles of the pelvis and the uterus. So post-procedure, the patient is asked to take antibiotics, painkillers, and she will be explained that she will have spotting and also watery discharge for a few hours to 1 day, and she can resume her work back after 2 to 3 hours after the procedure, and she can travel immediately back to her house if she is comfortable. So after this, her routine activities remains the same. She can walk around, she can cook, she can do all the household activities. So there is no restriction on her activities. So if she is working, then she can continue with her work, either work from home or she can go to the office. So resuming the sexual intercourse can happen the very next day. There could be slight cramping pain in the next day also, but otherwise it should be okay. If at all, if the patient is trying for pregnancy, conceiving in the same cycle will not cause any problems. And the HSG can be done in the cycle where they have taken treatment for ovulation induction also. So the report, she has to go back and see her fertility consultant to check whether the report is normal or abnormal. So the report can be three things. One is either it can be normal. Normal means both the fallopian tubes are patent and the dye is seen in the peritoneal cavity. Second, it can be either one tube is blocked and the other tube is normal. So that means there is unilateral blockage of the fallopian tube, and these cases we will discuss as to how to handle. The third thing is both the tubes can be blocked. So in these situations, again, like we will have to discuss the treatment options to the patients. So this is about HSG, and HSG is a non-invasive kind of like without anesthesia. It's a simpler test, and the other options could be a sonosalpingogram, which is called as SSG, or even a laparoscopy to check for the tubal patency. Thank you.